Unit 7, Brain Stimulation and Advanced Therapies. Module 7.1, Electroconvulsive Therapy, ECT, Nursing Care and Safety. Electroconvulsive therapy, or ECT, is an evidence-based medical treatment used for severe and treatment-resistant psychiatric conditions. It is carefully controlled, performed under anesthesia, and monitored by a specialized medical team. Modern ECT is not painful, does not cause brain damage, and is very different from historical portrayals often seen in media. ECT is most commonly used for severe major depressive disorder, especially when symptoms are life-threatening, such as suicidality, psychotic depression, or refusal to eat or drink. It may also be used for catatonia, severe bipolar disorder, and treatment-resistant schizophrenia. ECT works faster than medications, making it especially important when rapid symptom relief is needed. In some cases, ECT can reduce suicidal risk within days, not weeks. ECT involves the delivery of a brief electrical stimulus to the brain, producing a controlled therapeutic seizure. The exact mechanism is not fully understood, but ECT is believed to reset dysfunctional brain circuits and improve neurotransmitter regulation. Before ECT, the nurse completes a pre-treatment assessment, including a physical examination, laboratory studies, vital signs, and baseline memory and cognitive functioning. Informed consent must be verified. If a patient is profoundly depressed and lacks decision-making capacity, consent may be obtained from a legal guardian or family member according to policy. Medications that raise the seizure threshold, such as benzodiazepines or barbiturates, are typically held prior to ECT, unless otherwise directed by the provider. Patients must remain NPO for 6 to 8 hours before ECT, except for essential cardiac medications. The nurse administers atropine prior to treatment to reduce secretions and counteract vagal stimulation, helping prevent aspiration and bradycardia during the procedure. Immediately before treatment, the nurse asks the patient to void, removes dentures, contact lenses, hearing aids, and hair accessories, and checks baseline vital signs. Nurses should remain calm, supportive, and reassuring, helping reduce patient anxiety. An anesthesiologist is present and available throughout the procedure. ECT is performed under general anesthesia with a muscle relaxant, which prevents full-body convulsions. The patient is mechanically ventilated with 100% oxygen, and continuous monitoring of airway, oxygenation, heart rhythm, and blood pressure occurs throughout the procedure. After ECT, nursing priorities focus on airway protection and respiratory status. Mechanical ventilation with 100% oxygen continues until the patient can breathe independently. Vital signs are monitored closely, with attention to cardiac and respiratory stability. As the patient awakens, the nurse provides frequent reorientation to person, place, and time. Patients may experience confusion, headache, nausea, or muscle soreness. Benzodiazepines may be administered if the patient becomes agitated, as prescribed. The nurse continues to observe the patient until they are alert, oriented, and steady, especially during the first attempt to stand. The most common side effect of ECT is memory impairment, which may include retrograde and anterograde memory loss. This is usually temporary. Other possible effects include hypertension, arrhythmias, changes in cardiac output, hyponatremia, and migraine headaches. ECT is typically administered 2 to 3 times per week for an acute course of up to 6 to 12 treatments. Some patients then transition to maintenance ECT, which is individualized and commonly scheduled every 2 to 4 weeks. Many patients show significant improvement by the 3rd to 5th treatment, including relief of both psychological and physical symptoms of depression. ECT is a safe, effective, and life-saving treatment when medications fail. Nursing care centers on pre-procedure preparation, airway and cardiac safety, post-procedure monitoring, patient education, and emotional support.